Welcome to Thoughtfully Mindless. My guest in this episode is Daniel Gospodarek. After suffering a traumatic brain injury in 2009, Daniel was inspired to pursue his current career as a licensed clinical social worker in the state of Colorado. He works full-time in a psychiatric hospital and part-time in private practice. He works with mental health and recovery and provides a one-on-one and couples therapy in his private practice for those who experience mental illness and trauma. We discuss his traumatic brain injury experience and how it's shaped his current approach to mental health and recovery. He offers great insights into mental health and the mind-body connection. And with that, let's welcome Daniel. All right, Daniel, thank you so much for joining me today.
I appreciate just being here and being able to chat with you.
Yeah. So in 2009, you had a traumatic brain injury. Can you go into that a little bit and how that led you to where you are today and
Yeah.
what you've been doing since then?
Yeah, for sure. So, I'll kind of give a highlight and then we can go back and kind of get a little more specific in terms of recovery and like what that was like and in
Yeah.
pieces of that nature. So, yes, July 2009 was in a severe automobile accident and sustained a traumatic brain injury that nearly killed me. Um, from that kind of experience working with all of the medical professionals, I was kind of, directed to this helping profession. Before the TBI, didn't really know where I was going with my life. Military, business degree. But after that TBI, it was like, okay, somewhere here. I just didn't know where. Then I actually had a conversation with my sister, who's a social worker as well. And she was like,
Hmm.
check this profession out. And I did. And I checked out the curriculum and I was like, yeah, I think this would be cool. Graduated with my undergrad in social work in 2015, January 2015, and started working for a year or two, and then figured out I needed to go get my master's before I could really do what I want to do, the one-on-one therapy, the one-on-one support, the family support, things of that nature, kind of work in those capacities of hospitals or the VA. And then in 2016 I started my master's program, and then since then have been working on, obtaining my full licensure as a licensed clinical social worker. Currently work in an inpatient psychiatric hospital, and then also have my own private practice on the side where we focus a lot on mental illness, heavily focus on trauma, PTSD, post traumatic stress disorder, and then CPTSD, complex post traumatic stress disorder, as well as traumatic brain injuries.
Okay. What can you go into the specifics on what happened with the accident?
Yeah, yeah,
Yeah.
definitely. So it was just a Tuesday evening. My childhood neighbor was driving the vehicle, and we were actually slowing down for a stop sign in a rural area, and the two right tires went off the road, and then there was an overcorrection, and then we were in the oncoming lane. There was another overcorrection, and then we rolled four times. So I think if my memory serves me correctly, it was we rolled two times on the road, one time in a ditch and then once into a field, or it was three times on the road and then once off that into the field. I can't remember correctly. But so from there I was unconscious. I don't remember anything whatsoever. Um, if it wasn't for the driver and him locating our cell phones, calling EMS, calling his mom, who's a nurse, and her speaking with the EMS people because we were in a more rural area, and she essentially told them, if I have a traumatic brain injury or just head injury, that getting me to a rural hospital without having the correct medical um, care could delay in medical interventions and I could die. So they opted to take me right to a higher trauma level one from her conversation with them. So I
Okay.
definitely owe my life to those two people.
Did you have to get airlifted or anything?
I did not. They used the jaws of life. Per I was unconscious, so I don't remember anything. But I was told that they use the jaws of life, and no, that was kind of one of the running jokes because it's interesting when you go through these dark places. Sometimes you find humor and you can laugh about stuff, and it's like I was right there. Like, couldn't I have gotten the flight for life? But no, it was
Yeah.
this ambulance ride to the hospital, and then from there, I needed to have a craniotomy, or they removed part of my skull to stop the bleeding, and then um, I had a fractured skull. My left lung was collapsed, and then I also sustained a stroke in my left prefrontal cortex, or my left prefrontal lobe.
Okay. Yeah, I remember seeing on your site that you said you had 17 months of therapy.
Yeah.
Was that speech therapy, physical therapy?
Yeah. So I did 10 days in the ICU, 7 days inpatient rehab. Inpatient rehab is where physical therapy, occupational therapy, and then speech and massage therapy kind of commenced. After 7 days of inpatient, I did another 3 months of physical therapy outpatient, so 1 to 3 times a week. And then I did speech therapy for 17 months afterwards. So anywhere from 1 to 3 sessions a week.
Okay.
Yeah.
Yeah. So you had like an aphasia? Did you have an aphasia or anything like that from the stroke?
So that was one of their concerns with the area of, because I had the area that I had the bleed in was my left temporal region, which is a huge language center of the brain. So they thought maybe I would have to relearn how to talk, but I was able to maintain that. The speech therapy was heavily focused on concentration, focus, multitasking, switching between tasks, um, and then also vocabulary around certain, I forget what they're called now. So but it's the words that sound similar, so like there,
Mm,
here, right? And
gotcha.
I remember specifically the speech therapist was like, tell me all the words that are like that you can think of, and I could only think of like four at the time, and I was like,
Mm,
I know that there are more, I just can't recall them. So
okay.
really kind of reconnecting a lot of those neural networks, and then
Okay.
being able to maintain focus in addition to the high level of fatigue that I experienced from the car accident and the brain surgery, because I was sleeping probably close to, I want to say 14 to 16 hours a day. So I was
Oh,
so
wow.
tired.
Yeah. Was it along the recovery path that you decided to make your career change, or was it after fully recovering?
So I think I had the conversation with my sister a few months after the accident, and I think the conversation actually stemmed, and I could be misspeaking, but I feel like one of the reasons I asked about where she was and what she was doing in school was related to the helping profession, but also she was one of the people that stayed at home with me because I needed to be supervised for a number of weeks after
Yeah.
the accident for seizures and stuff like that. And she was able to move around
Okay.
her school schedule and like do some stuff online, go to school, right? And I was like, wow, that's so flexible. Like they're so understanding. And that was kind of one of the pieces.
Yeah.
And now I'm into this social work profession, and I'm like, wow, like we operate in the gray zone. Like we have to be fluid
Yeah.
in our roles. We have to be fluid with our therapeutic interventions, to meet people where they're at, to just support people in recovery. So I was like, it kind of makes sense that that would be embodied in their curriculum.
Yeah. So, how has your experience with that traumatic brain injury shaped your approach to the therapy and your connection to your clients?
Yeah, I I definitely think there's a level of empathy in terms of recovery. Recovery looks so different for every person and for everything that we have challenges with.
Yeah.
Right? Could be addiction, could be mental health, could be trauma and deep traumatic brain injuries, whatever, grief and loss, right? And I think having and sitting with somebody that maybe doesn't have the exact experience, but has a walked process of experiencing being knocked down, like challenged to the
Yeah.
core in terms of identity, in terms of sense of self, grief and loss, right? There's a lot of things that I still can't do that I used to do, right? A lot of things I
Mm.
missed my senior year of high school because friends were doing X and I was sleeping. So there
Yeah.
are those pieces in terms of anxiety, right? Fatigue that people can relate to. Maybe they're not exactly, 100% the same, but I think it gives that shared empathy.
So do you still have more fatigue than the average person, like, currently?
No, I would say that my fatigue probably lifted probably like my sophomore year of college. So that would have been like
Okay.
2012. So about 2.5 years, like 2.5 years afterwards. It was, yeah.
Did that make I mean, I'd imagine that made college fairly hard your first little bit, right? Like,
Yeah, I mean,
college students are known for not getting much sleep anyway.
right. So my accident was going into my senior year of high school. And one of the things and I'm fairly certain it was a doctor or doctors that told me I probably wouldn't graduate with my high school class that I started it with. And I told them no, I would. And I did. I met the minimum credits, but we operated on a block schedule for our high school. So we only had 4 classes a day. They were hour and 20-ish minutes each. So for the first semester back for high school, I would go to 2 classes and then come home essentially for the first semester and just sleep for 1 to 3 hours because I was just so exhausted. And then second semester, I was able to go a full day and then do a half day. So it was the fatigue was there, and it will run your life if you're not continually kind of like pressing those boundaries and pushing yourself, right? And I think that's what recovery is. That's what therapy is we don't grow in our comfort zones and supporting people
Yeah.
through that, right? Like it's hard and right. Like, what's the other side of this conversation?
Yeah. Um, it it seems like you'd be able to relate to a lot of different mental things too. Like, I know with depression, fatigue is a big thing, right?
Hmm.
And um, you kind of have to force yourself to get through those moments because, I mean, you have a life that you want to live, you have goals and stuff like that, even though you have depression or anxiety.
Hmm.
So I'd imagine you can relate pretty well to people that have that, even if you maybe haven't had depression yourself.
Yeah, and I I think it's also this interesting balance of like, yes, I have this lived experience and I don't always bring it into the therapy room. Like, I don't tell every client that I have a traumatic brain injury
Yeah.
and they can read it on my site, right? That's one thing. But I re- I really try to use it sparingly when somebody's appears to be really stuck, right?
Okay.
And to
Yeah.
say like we are going to be in these adverse situations many times in life. Adversity will strike unexpectedly, right? How do we look at it and hold it and continue with our values, continue healing,
Yeah.
whatever healing or recovery looks like?
Yeah. How do you feel like your experience with traumatic brain injury has shaped your perspective on the mind body connection when it comes to mental health?
Hmm. That's a really good question, and I think it's a big answer. So I'll start just kind of chipping away. I don't think our society teaches a lot of mind body connection work. School, um, even to some degree sports. I think sports are very very incredible for shaping character, shaping identity, shaping our values. And it's not just all about mindset. Mindset's a huge piece, but we also need to be able to tune into our body to say, is there something going on, right? What is our nervous system telling us? Are we hyper regulated? Are we hypo regulated, right? Or hyper or hypo aroused? It just depends. Not to bash sports, I think they're great. They do.
Yeah.
But I think just integrating some of those pieces could help just people be a little more attuned to not only themselves, but also maybe what other people might be feeling. And my specific TBI, right, in this journey of mind body connection, I didn't have a lot before that.
Yeah.
And it wasn't until I started therapy, it wasn't until like I was in speech therapy and I was feeling this frustration of this inability to recall words that I knew, but I couldn't remember, right? Or
Yeah.
the challenges I had falling asleep at night because my mind would just race and I would feel that frustration and anger, right? So it was almost like it was taught to me through the recovery process of experience as well as in therapy itself or counseling.
Yeah. When you mentioned anger, what was your anger at specifically?
Yeah, that's a good question. So anger, irritability, impulsivity are pretty common with a lot of TBIs. A lot of it was directed at like annoyances.
Mm,
Okay, like you
okay.
just spent 5 minutes telling me something when you could have like said it in one sentence, right? Or I remember getting really upset at my dad. Um, he was a farmer and he would wake up early, do dishes at 4 a.m. But I was almost like hypersensitive to hearing things, and I could hear the dishes clanging at
Yeah.
4, and I couldn't sleep through it. So I would get
Mm,
angry at that, right?
yeah.
And it was just like those things, and it's another hallmark of TBI is not having a filter on like what you're saying. And I think
Yeah.
not having a filter and having that 0 to 100 challenge with impulsivity and anger just kind of mesh to that perfect storm that your support system, they give a lot and they take a lot in terms of TBI recovery because they're around you so much.
Yeah. What are some common misconceptions about traumatic brain injuries that you've encountered, and how do you address those?
hmm I think one of the biggest ones are those invisible scars or wounds, even though you appear externally okay, right? And people saying you look great, and it's like, but I don't feel great. Like my head is like
Yeah.
looking through a fog right now, and like if
Yeah.
you asked me to do this algebra problem or to write an essay, I would probably take me a week to do it, right? So I think people we look at things on the surface and we make assumptions that people are doing better, maybe better than what they are doing, right? And that has been
Yeah.
the biggest one that I've ran into through my recovery process. Not so much anymore, but especially at the beginning, family members, friends, right? So that's probably one of the biggest ones that we just don't know what's going on in terms of somebody's head, in terms of somebody's body, right? We can't see those invisible scars. That's why I mean, that's part of the reason there's therapies to work on those things, right? But again, like our society also needs to have an awareness that it's okay to ask for help, that it's okay to, sit down and chat about these things.
Yeah. You mentioned other people not being able to know what's going on in your head, the scars that are there.
hmm
Um, can an individual who's gone through something like that really identify what's going on in their own head, and the scars that are present, and the trauma that's really present there? Can they recognize that without external help?
Say that one more time. I'm not. Am I looking at that at other people or in myself? Confused.
Yeah, so you mentioned it with other people not being able to see what's going on in your head. Are you able to really figure out what's going on in your own head without therapy and help when you've gone
Gotcha.
through something like that?
I don't think I had the cognitive capacity right after the accident to figure it out. Like, my brain
Okay.
was literally healing, right?
Yeah.
And until that brain heals, and even if there's scar tissue, right? Like, things are murky. And then we need to look at like neuroplasticity, neurogenesis, and kind of learn different ways of doing things, compensatory means to navigate this world. But I don't think for probably the first like maybe 5 to 8 months, I was even in a place to like have those kinds of conversations,
Yeah.
like initiate those conversations. Other people could have them for with me, right? But I wasn't even in that headspace to consider that. I was more like,
Okay.
okay, I know, like, I know if I go to sleep, like this is kind of like how concrete my brain processing was. Like, okay, wake up, go to school, take a nap, and then I knew that I dreaded the night because I would have to go to bed at 8, and I wouldn't fall asleep by 10 until 10ish, and then wake up and do it all over again.
Yeah.
And like that was like my process for the first few months of like just existing, right, as my brain was healing. And then
Yeah.
I was able to have some of that
Is
kind
there
of go ahead.
I was just gonna ask it, is there anything specific that helped you start falling asleep better over time?
Um, I think there was a low dose of melatonin that helped, and then a lot of it was once I could get some of that higher order thinking back online. I mean, in therapy, we call it like metacognition, right? Thinking about our thinking,
Mm.
and start really thinking of okay, like this process of my thoughts racing is not helping me fall asleep. This anger is not helping me fall asleep. How do I let it go? How do I just maybe not notice it, right? And start
Yeah.
having those conversations internally and engaging with that material. That's very much what therapy is like, right? Like the therapist acts as that voice to start those internal conversations on some level. And
Yeah.
and I wasn't in therapy at that time. So it was literally, and I think that's where a lot of that grit and just perseverance came in of like, I need to sleep. Like, no human can escape that, right? On the long term. And especially coming on the heels of a traumatic brain injury. So either I figured this out or I don't know what the next step is, right? So it was
Yeah.
kind of the back was against the wall.
Yeah. Um, so let's fast forward to now. You're doing
Hmm.
therapy for other people. You're helping others. On
Hmm.
your website, for Revitalize Health, you have 4 different specialties for
Hmm.
therapies that you use. Acceptance and commitment therapy, cognitive behavioral therapy, cognitive processing therapy, and then the fourth is eye movement desensitization and reprocessing therapy.
Yeah,
Can we walk through those, and
sure.
can you kind of explain what those are?
Yeah, definitely. So starting with acceptance and commitment therapy, ACT for short. Um, Really, the precipice of ACT is how do we create psychological flexibility in terms of our thought processes, in terms of our mood, how we navigate life. It's underpinned by a few different pieces. They call it a hexaflex and ACT. And so it's values, committed action, present moment focus, which is very similar to mindfulness, diffusion, and values. Um, Wait, I'm sorry. Values, committed action, present moment focus, um, action, present moment diffusion, and then sense of self, which is like our self esteem, our identity. How is that formed? Are there pieces of that that we would like to change? Cognitive behavioral therapy is a very prominent therapy in today's society, started in the 60s,
Yeah,
and ACT is actually a derivative of CBT. So, cognitive behavioral therapy looks at cognitions as well as behavior, and how do those things go together? How do we influence our ability to think around things? Also, looking at
yeah,
cognitive distortions, right? So, all or nothing thinking, black and white thinking is another way to look at that. Overgeneralization, um, there's a few different there's a number of other cognitive distortions that can kind of creep in, and
Yeah.
how do we make our thoughts more accurate, right? Because oftentimes our thoughts, maybe we might like to think that they're accurate, but they may be a little inaccurate. And how do we fine tune them, right? Cognitive
Yeah.
processing therapy, CPT, was formed from CBT2, but it's only for post traumatic stress disorder. So people who have been diagnosed or have that diagnosis, um, the researcher on that for CPT is it needs to be full PTSD threshold,
Okay.
and that just looks at restructuring inaccurate thoughts specifically related to trauma, um, and then also bringing in those cognitive distortions, um, and how they influence our inaccuracies of our thoughts and just how we navigate life. Eye movement desensitization and reprocessing started in the late 80s by Dr. Shapiro, and it was actually started as eye movement and desensitization. There was no reprocessing, and then in time it just expanded to have the R, the reprocessing at the end. Essentially,
Okay.
how EMDR works is by engaging both hemispheres of the brain, bilateral stimulation, so tapping, eye movements, watching something on the screen, going back and forth, and making sure you're crossing that midbrain, and that essentially jumpstarts what's called our adaptive information processing system inside of our body, which all of us have. And an easy way to think of that is if you cut your hand while you're cutting carrots, right? In a couple days, if you don't need stitches, what tends to happen to that cut?
Just get a scab, right?
Right, right. And then let's say you were cutting chicken and a piece of bacteria got in there and it was infected. How would you know?
I It would get inflamed. You'd see pink
Hmm.
inflammation around it. You might see like white, um,
Pus.
pussy kind of
Yeah.
infection,
Tender,
obvious
hot, right?
infection. Yeah. Yeah.
And that's a symptom of the infection, right? So how
Yeah.
the AIP, adaptive information processing system, looks at trauma is that our body stores those traumatic experiences, and trauma doesn't have to be PTSD. It could be, you know, being shamed in a work meeting, right? Or whatever it is. And sh- our nervous system stores those experiences, images, thoughts, emotions, sensations, right? Temperature. And because of that stored toxicity of that trauma, we then have symptoms, just like if that cut your hand and there was bacteria in there and now you have an infection, right? So maybe we
Yeah.
have suicidal thoughts, maybe we have um, trauma symptoms, right? Hypervigilance, whatever it is, or inability to think about it, think, or I'm sorry, inability to navigate relationships in a healthy manner, whatever it is, right? And then that bilateral stimulation starts that body's natural healing process, just like if you were cutting that carrot and you cut your hand and it's healing okay, and it starts healing it through to integrate that trauma properly into your nervous system, and then we see the symptoms typically fade away.
Okay. How many sessions are usually involved in that?
So that is a great question. There's probably no set. It just depends on the person, what they're bringing in. Is it a one-time shame incident at work, right? Or is it chronic,
Yeah.
prolonged childhood trauma that has now influenced complex post-traumatic stress disorder symptoms, right? So
Yeah.
there's not like a set protocol. Um, it's really
Okay.
when have we established regulation of the nervous system and integrated those memories are kind of when the
Okay.
EMDR therapy sessions are done.
Okay. I actually just heard about EDMR. It was a few weeks ago that I really came across it. I was talking with a friend, or a couple friends, and
Mhm.
yeah, it sounds very interesting.
Yeah, and it can and EMDR, I mean, there's a lot of different areas where it's showing efficacy, self-harm, suicidal ideation, depression, anxiety, panic, substance use, as well as grief and loss. It's just pretty interesting how we're kind of seeing EMDR's research and also some of its utilization, right, being used to help
Yeah.
people heal.
Yeah. Is it? So I know it was created in the '80s, but is it Is it becoming more popular lately? Like, I've heard about the other therapies, like, especially cognitive behavioral therapy. That's
Mhm.
very well known in.
I think it's becoming more. What do I want to say? I think it's becoming a lot more mainstream now. In the past,
Okay.
especially like 5-10 years, it's becoming much more
Okay.
mainstream, and I think it's also gaining traction because what you're seeing is it being used for many different things, right? Like we know CBT
Yeah.
is effective for anxiety, depression, addiction, even trauma focused CBT and its derivatives. And now what we're seeing is EMDR not just being effective for trauma, PTSD, complex PTSD, but also depression, anxiety, right? Addiction, self harm.
Yeah.
So we're starting to see that utilization expanding. I think there's a lot of traction showing up now.
Okay. Is that usually paired with other therapies, or is it
Mm,
a standalone therapy?
Usually that's a fabulous question. It will depend on the client. It will also depend on the age of the client, meaning like typically children and adolescents process through trauma a lot faster than adults. And that's because they have a
Okay.
lot less lived experience. They have a lot less, we call them in terms of therapy for EMDR. They have a lot less like feeder memories that are influencing the reprocessing that's coming up. And there are a lot of different modalities that are being integrated into EMDR. So some of the big ones are um, somatic experiencing, internal family systems, IFS, and then sensory motor are being kind of integrated into EMDR. And to really hit, EMDR treats trauma from the bottom up versus talk therapy usually works from the top down. And sensory motor, IFS, somatic experiencing, SE all work from the bottom up. So
Yeah.
we use them not interchangeably, but we use them while we're doing EMDR in terms of maybe interweaves or working with different ego state parts, so different parts of ourselves, right? We have a lot of different ego states easily explained are we have different parts of ourselves that make us up of who we are, right? We have a child part, we have an adolescent part, maybe a business part, maybe a professional part, brother, sister, right? Child. And
Yeah.
we have all these different parts that influence who we are, how we navigate the world. And sometimes we have parts that are maybe formed during trauma or stress, right? Maybe we have a protector part that kind of takes control, deviant adolescent, wounded child part, whatever it might be, or maybe there are guilt parts of ourselves, right? And we can work
Yeah.
through ego states to increase communication between those parts and not create uniformity, but just create integration, and then that helps reprocessing in and of itself. So,
Yeah. Okay. Um, you've worked at a psychiatric hospital for a while too. Um,
mhm.
what has working in a psychiatric hospital taught you about the human condition?
Mm. I don't know if it's just been the psychiatric hospital, my own recovery, and also private practice, but I think the human spirit is so strong when you look at what people can endure and hold and then still show up and spread kindness and love and joy in this world.
Yeah.
Um, I think it's also showed too that it only takes one or two big stressors to really tip us into having an increase in mental health symptoms, addiction challenges, whatever it might be. And
Yeah.
people are often thought like, oh, like people who are sent to hospitals, especially psych hospitals, are different. There's not. There's not a lot of differences. We're all human beings. We all bleed the same.
Yeah. What do you feel like? What's something that you'd like the general public to understand better about psychiatric hospitals and psychiatric care.
Hmm. Again, I think it comes back to that. We don't know what somebody's experiencing internally, right? But they get
Yeah.
there's a lot of judgment around, like, oh, that person's homeless, that, whatever it is, or even that mental illness leads to, violent crime, which the research shows it's a very small percentage. Uh, so I think just those pieces, as well as, if you or one of your family members was ill, how would you want them to be treated? Right? What kind of
Yeah.
compassion would you want them to see? Empathy, support. Those are all kind of the take home pieces.
Yeah. When I was probably about 19 years old, I was working as a certified nursing assistant, and I did spend a few shifts on a psychiatric ward. Um, it wasn't anything I did full time, but I found it kind of pretty mentally draining, even those few shifts. How do you maintain your own mental health when you're in that environment all the time?
Hmm. The word that sticks out to me is values, right? So,
Okay.
um, if we can stay aligned with our values or our mission, right, whatever that is in life, we can
Yeah.
endure a lot. And one of my values is working and supporting and helping people achieve and maintain recovery. So for me, it's work, don't get me wrong. And it's also beautiful to see people grow, to see people heal and get to points in their recovery where they're able to leave the hospital or do things
Yeah.
even in private practice that they weren't able to do, right? To say, oh wow, like I have a romantic relationship starting, right? Even though I
Yeah.
have trust challenges. Like, that's also growth.
Have you noticed any common threads in people that improve versus people that kind of go deeper into their mental disorders?
I think anecdotally, not like evidence-based research,
Yeah.
that there has to be a commitment to the process. It's not a this isn't a quick, 3 months of therapy. Usually it takes time to change those neural patterns,
Yeah.
form form new neural patterns. And one of the analogies I use a lot of is if you've ever walked through snow in the woods, like 8, 12 inches of snow, even with snowshoes, is the first time you walk through the snow, is it easy or difficult?
Yeah. Pretty difficult.
Right? Even the first few passes, especially if you're not in snowshoes. And that is essentially, well, let me back up. Then if you go on that path 20 or 30 times, what happens to that path?
Gets patted down and easy
Right.
to walk on.
And that's how our neural networks work too, right? So sometimes I think
Yeah.
people want to heal, which is great, but they also can't do it quickly as they want. And that commitment to the process is so important because some of these
Yeah.
neural patterns, these neural networks have been firing for decades, right? And 3 months of trying to change them is not going to be, the teeter totter is still way out of balance, right?
Yeah. With regard to traumatic brain injury,
Hmm.
um, it appears that there could be some potential for like marijuana to positively impact those with TBI. Have you observed anything with patients that potentially use marijuana? I know Colorado has
Hmm.
legal, recreational, and medicinal. So, have you noticed anything with people that use versus don't use and have gone through that?
Not anything where I can say there's a correlation that I could draw.
Okay.
Um, yeah, not anything in terms of a correlation. I've seen, you know, patterns of maybe where marijuana use becomes more of a avoidance tool or more of a numbing tool to
Mm,
address challenges. I've definitely seen it help in terms of chronic pain, in terms of stimulating eating in those facets, but nothing that I can say, TBIs and marijuana use. go hand in hand or something on that level. And I'm also not too
Yeah.
familiar with the research on specific TBIs and marijuana use being used adjacently or adjunctly.
Yeah, one that I saw, it was from 2014 and it basically did a toxicology on people who
Mhm.
had a traumatic brain injury. So it appears that they were testing if they were marijuana users leading up to the traumatic event,
Mm,
and they found lower mortality in the people who were marijuana users prior, which I
mm.
found very interesting. I didn't know that before.
Yeah.
But
I don't and that was when they sustained the TBI?
yeah, so when they sustained it, they did a toxicology at that time, and
Mm,
there seemed to be a correlation with people that have had it and a lower risk of mortality.
hmm.
So it was interesting. But
Yeah.
I'm happy you touched on the potential negative side,
Mhm.
being used as a crutch or avoidance tool because I'm I'm pro marijuana in the sense I think I think it's been demonized in the past and I think
Mhm.
could be a positive drug, but it can also be a negative drug. It has its positives and negatives for sure.
Yeah. I mean, most things in life that we do all do, right? Even working out. I think
Yeah.
that can also lead to challenges, inability to attend work shifts. I mean, and we're talking like excessive use, right? Or
Yeah.
excessive amounts of working out when you spend 3 4 hours a day in the gym, unless maybe you are a bodybuilder, right? And then maybe that makes sense. But
Yeah.
if you also have a family and or people you care about that care about you, and you also have a job, and right, that detracts, and there might be more going on there
Yeah.
than meets the eye. But yeah, I think
Yeah.
I know that there's new research coming out around MDMA, around hallucinogenics, and I think it'll be really interesting to see where that research goes, even like ketamine, especially long
Yeah.
term research, because I've seen a lot of people feel better when they're using it, but it is when sometimes when they're not using it, they start to drift back. So
Yeah.
it'll just be interesting to see what more of those longitudinal studies say, and being open to whatever the research kind of indicates, right?
Yeah, psilocybin specifically seems like it could have real potential for a
Hmm.
lot of mental disorders and traumatic brain injury because it seems like there's some kind of something going on with your neurons when you're on that, and it could like I've taken psilocybin, and if I have an intention, I
Hmm.
find taking psilocybin, doing a low dose or even a higher dose, it's been very effective with me committing to something. If I want
Hmm.
to make a change in my life and I go into a session with psilocybin and I put that intention into that session, I feel like it has very positive changes for me. Like when I was quitting alcohol, I used psilocybin to kind of affirm what I wanted to do. And I do feel like that helped. I mean, I was doing other things too. So I can't say, oh, psilocybin is the reason I don't drink anymore,
Right.
but it definitely helped make be more steady in what I wanted, be more
Hmm.
resolved. So,
Yeah. And I think the culture around some of those drugs is shifting, although slowly.
yeah,
I mean,
yeah,
it's like turning a massive boat in a sea storm, right?
yeah,
Um,
yeah,
so, and I think I mean, I can't predict legislation and where it will go, but I mean, we've seen a number of states already adopt marijuana, right? And
yeah.
I think
Well,
time
in
will tell.
Colorado, you're in a state that's kind of ahead of the game in that sense. I think
Mhm.
you decriminalized psilocybin mushrooms, I believe, like within the last few years, if I'm not
Mm.
mistaken, which
Yeah.
is, I think, a step in the right direction. Like, there's certain
Hmm.
drugs that just their risk of harm is lower, and I think we should recognize that not all drugs are the same.
Yeah, and other countries have already done it, like Portugal and stuff. So
Yeah.
It'll be interesting to see what the research, comes out of their countries. What does that say, right?
Yeah.
Do they see an
Yeah, it'd
uptick
be
in,
very interesting to see.
violent crime? So it'll be
Yeah.
interesting.
With medicinal mushrooms, not psilocybin mushrooms,
Mhm,
one mushroom that comes to mind is lion's mane. Um,
mhm,
it has been shown to have the ability to induce nerve growth factor synthesis in nerve cells. Have
mm,
you seen it used in patients, or I know this probably wouldn't be something that's prescribed by anybody, but maybe some patients have used
mhm.
mushroom supplements alongside of anything. Have you heard of anything like that?
I've heard of it. To be completely honest, I have not seen it used. I've heard
Okay.
people who have used it. Um, I can't speak to whether it's been, extremely eye-opening or, dramatic shift, or been also on the other side, or been harmful, right? So
Yeah.
I just don't have enough data to be able to
Okay.
to speak to that.
Okay. Yeah, no problem. So I find schizophrenia and psychosis very interesting. Um, and speaking of marijuana, there's been some link to potentially schizophrenia being induced by marijuana use earlier, like
Especially
earlier in your
early
brain
onset people.
development.
Mhm.
Yeah, yeah. Can you dive into what you've observed with people with schizophrenia and psychosis? Like, what are these disorders?
Mhm.
Were there known causes that led to um, the symptoms of it, and does the severity vary?
Yeah. So I think when you think of like schizophrenia, when you think of psychosis, schizoaffective disorder, right? Those are all they can all present very differently. So in terms of schizophrenia, right, like there's usually the presence of auditory or some form of hallucinations, and those are positive symptoms. So auditory hallucinations, um, visual hallucinations, olfactory, tactile hallucinations, and there's one more that I'm just not remembering offhand. Um, and I think it's taste, but there's a specific name for it. Um, and then there's the delusional components, as well, to the positive symptoms. And then we have the negative symptoms, which are like the isolation, the decrease in expressive affect, inability to read affect shifts in another person, right? Almost like that attunement in a conversation, right? Like if you just crossed your arms, I'd be like, oh, is everything all right? Sometimes that's lacking. It's not just in schizophrenia, but also TBIs or other mental health challenges. But in terms of schizophrenia, that's one of them, and there are a few more that we watch for. Um, let's see, isolation, negative emotion, affect, um, just the inability to experience pleasure. Like there are many different forms of things that can show up. So in terms of severity, I think there's a huge difference in severity for somebody who has maybe had a first psychotic break, and they could have a psychotic break but not meet schizophrenia threshold in the
Yeah.
DSM-5 TR, or the Diagnostic and Statistic Manual for mental illness. So those, and that's why I mean they're different. But for somebody who has a psychotic break and then they're like, okay, like maybe I need like a dose of medications, you know, and they might stay on a low dose of medications. That might be all that they experience versus somebody who maybe has challenges staying on medications, can see an increase or uptick in symptoms if they're not on them. And I actually read this really interesting book, on EMDR for schizophrenia and psychosis by Paul Miller. And he is looking at using EMDR to target, psychotic material, especially if there are sometimes trauma earlier in life, or traumatic experiences can predate onset of certain psychotic symptoms, and targeting those with EMDR has been shown to have some efficacy. So that's one of the areas that I'm really curious in. Another more powerful therapy as well. It's a derivative of CBT, but it's cognitive behavioral therapy for psychosis specifically. And that is instead of targeting the symptoms, we target the themes of the symptoms. So maybe a lot of them are persecutory, so maybe the person feels unsafe. Maybe some of them are related to, not being worthy, not being lovable, and targeting those themes, and then seeing some of those symptoms decrease. But also, the other part of therapy and treatment is also seeing an increase in functioning, right? So if
Yeah.
there's, for example, like somebody who still has auditory hallucinations, but they're able to maintain a full-time job and like function and meet their needs, like how much of that do we want to disappear, right? Maybe if the client wants it to go away, right, then that would be one thing. But if their functioning levels also here, like have we also reached maximum efficacy?
Okay.
So it just depends.
You
And go ahead.
you mentioned positive and negative symptoms,
Hmm.
but it didn't sound like you were talking about good and bad symptoms. Can you dive into what you mean by positive and negative there?
Yeah, so positive symptoms are like ones that would be like in addition to what somebody, like if somebody was at neutral, right, didn't have any symptoms, and there are positive ones, so essentially added to whatever that person is experiencing in life. So they're having
Okay.
hallucinations, right? They're having delusions. Those would be considered positives. And then the negative
Okay.
ones would be like going going backward and not having them, right? So negative or
Okay.
emotional affect, right? Decrease in pleasure from once pleasurable activities, or decrease in ability to communicate, right? Poverty of speech, things like that.
Okay.
Hmm.
Um, are there any misconceptions about schizophrenia and psychosis that you come across a lot?
Hmm. I would still lump it underneath, like we don't know what's going on in that person's life, and sometimes
Yeah.
psychotic people have psychotic breaks or episodes because it's substance induced, right? So we need to be very careful on how we assess and treat people. And I think there's also this beautiful thing that we see with a person's functioning in time, that even people who have, the diagnosis of schizophrenia or schizoaffective disorder can still live very meaningful lives, contribute to society in ways that sometimes people who do not have those illnesses can, in terms of like creativity, right? In terms of
Yeah.
empathy, right? There's a TED talk, and I forget the person's name. I believe she is either the chair of their psychology program or psychiatric program at USC, in California, and she has schizophrenia,
Yeah.
right?
Okay.
And it's like you can still like live your life in this world even with that label
Yeah.
that people have imposed on you, right? And again, it comes to that recovery mindset, that grit, that consistency.
Yeah. Yeah. I think in general, people probably look at schizophrenia as mostly just completely debilitating.
Hmm.
That would be my view, not having too much insight prior to this.
Hmm.
I would think of it as pretty debilitating, and I think a lot of people would assume that's the case generally with schizophrenia.
Yeah, yeah. I think there's a lot of factors that come into play in terms of this. What influences the severity of the illness, right? How good is the treatment that they're receiving? What level of support system do they have, if at all? Do they have housing? Right? All those factors come into play. Are they connected to community
Yeah.
services and organizations? Um, because it can very much feel like you are on an island when in fact there are a lot of other people in this society, just the US alone, that experience those symptoms, or maybe a variation of those symptoms, right?
Yeah. When you have when somebody has psychosis or schizophrenia, they go through
Mhm.
therapy, they take medication potentially. Is there a point that they can fully get over that, like get past it, or is it forever a part of their lives in some way or another?
Mm, it's a good question. And that's one of the reasons I love that EMDR book for psychosis that I mentioned by Paul Miller. So he referenced a lot of early research in that book, back from like the 1890s and 1900s, um, when schizophrenia was referred to as the schizophrenias, and it was divided, and I believe it was five different categories into almost types of dissociation. And fast forward to when this book came out, the psychiatrist, Dr. Miller, is looking at doing EMDR with some of these folks that have symptoms of psychosis, and seeing reductions in symptoms, or the person's ability to reduce dosages of medications for like antipsychotics, or being able to remove antipsychotics entirely. So I don't know for certain. I've seen most people have to be on some sort of medication, psychotropic medication, to support
Yeah.
recovery. But again, research is coming out yearly, right? Interventions are changing. Like we
Yeah.
don't know what that will look like in 5 years, 10 years, 15 years.
Yeah. Yeah, definitely.
I mean, especially the research around like Parkinson's disease and Alzheimer's, right? We're able to
Yeah.
like be able to stop neurodegenerative disorders or implant neurons, right? And maybe if schizophrenia is related to, decrease in dopaminergic neurons, can we then implant neurons, right? Like research is shifting so quickly, and I think it'll be really
Yeah.
an incredible thing to be on that forefront.
Definitely. In your experience, like what you've observed, what are the typical reasons that people have schizophrenia or
Mm,
psychosis?
mm.
Is it typically drug induced, or are there other, is it stress induced, or what do you typically see?
I think there can be a variety of symptoms, or a variety of kind of precipitating events. Trauma is one. Um, Stress, epigenetics plays some role. We don't know exactly what, but even if it's a low role, right? Do parents or aunts, uncles, brothers, sisters, especially referring to only biological, right, not adoptive, do they have challenges with
Yeah.
mental health disorders or illnesses? Um, I don't know if there's like a hard and fast like this is the cause of it, right? I've seen
Yeah.
substance use stuff come through. I've also seen, people using prolonged substances for decades or years at a time, and that is also now your brain is at a point where the neurons aren't there. So,
Yeah.
that can be difficult too, because then sometimes medications can't impact those symptoms because the brain is not there to absorb them.
Yeah. With schizophrenia, if I'm remembering right, doesn't it normally manifest by your late 20s or something like that?
Yeah. Yeah, usually mid to late 20s, early 30s. People can have late breaks. Again, then we're kind of looking at, is this schizophrenia? Is this just a delusional disorder? Is this a psychotic break, right? Because all those things are different in terms of schizophrenia. Um,
Yeah.
so it depends on the assessment of the individual, but could it happen later in life? Yes. Has it happened?
Wow.
Yes. Right. But I think that's kind of like when you think of like the bell curve for like standard deviations.
I've been reading a bit about shadow personality traits. Carl
Mm,
Jung um, kind of was the first person to really go into that. And they're I don't know enough to like speak competently about it, but I what I understand is it's personality traits that are not part of our ideal ego that we kind of
Hmm.
repress, but that are still present in some way or another. So maybe we want to be very generous, but there's a shadow part of our personality that is opposite of that, who's
Hmm.
very very like selfish and
Hmm.
stuff like that. So do you have any opinion about how shadow personality influences mental health over the lifespan?
It's a good question. I mean, I know Carl Jung, and I've heard of the shadow work before. I'm not that familiar with it in terms of what I mentioned with EMDR with those ego states, right? And I think there might be some overlap there of,
Yeah.
do we have parts of ourselves that maybe only come out at certain times or influence, dynamics or interpersonal interactions or how we show up to certain settings or work, right? And sometimes those, in ego states, we call them apparently normal parts, and then we also have emotional parts. And some of those emotional parts are the ones that are typically created like during moments of strong emotion or stress,
Okay.
and so trauma.
Yeah.
Um, so maybe there's a part of, you know, I'm a victim, and like maybe always taking that role, right? But we also know from research is that through EMDR and through ego state work that we can start to shift that awareness of parts, increase the awareness of it, and increase the communication of all those parts together so that we form unity, or I'm sorry, we form integration, not unity.
Okay. How do you help clients get over the shame and guilt that often comes along with mental disorders and mental challenges?
I mean, I usually target it with EMDR.
Okay.
So EMDR will not reprocess anything that is functional, right? So going back to the when I
Okay.
mentioned like EMDR for grief and loss has been shown to help be effective with not the stages of grief and loss specifically, but are there pieces of that kind of, let's say, loss experience where it's like I should have noticed that, I should have picked up on that, I should have been there, right? And that leads to guilt,
Yeah.
right? And EMDR can help process the dysfunctional pieces of shame, of guilt, right? Will there always maybe be some like longing or loss? Yeah, there might be, right? And that's fairly human. We wouldn't have
Yeah.
an emotional response to whatever loss experience we went through if that person, that pet, right, didn't mean something to us. And that's part of being
Yeah.
human. It's part of life is feeling
Yeah.
shitty emotions sometimes.
Yeah.
We can't
Definitely.
just always have good emotions.
Yeah. When when you're dealing with grief and loss, I think one of the hesitations I could imagine people have is, sure, I want to be healthier about the grief and loss, but I don't want the memory of the person or pet that I lost to fade at all.
Hmm.
How do you reassure people that that
Yeah,
won't happen?
sure. So EMDR will not change a memory. It'll change your relationship to the memory because those dysfunctional
Okay.
pieces will fade or be integrated.
Okay.
So, and
Okay.
that's why grief and loss, and when you're doing EMDR work with grief and loss, it's you can't rush somebody through the 5 stages of grief and loss. It's just not
Yeah,
humanly
definitely.
possible. And we also operate on a yearly system, so anniversaries show up, right? Memories show up.
Yeah.
Facebook is great for reminding us on memories. Sometimes it's really
Yeah.
shitty. And other things too, Amazon Photos, Google, right? They all have reminders, and that's also just a part of grief and loss.
Yeah, definitely. What have you noticed about the COVID-19 pandemic? How has that affected mental health and the services for mental health?
hmm So I think one big uptick in mental health or people seeking services at least for mental health. I think two, one of the positives that came out of COVID was this access to care via telehealth or online therapy, virtual therapy.
Yeah,
I think it really plowed down people's boundaries in terms of access to care.
yeah,
Rural areas, as long as you have a 5G network or Wi-Fi that can do a video chat. Now you can do talk therapy, you can do EMDR, right? All virtual. And that is
yeah,
so powerful. So those are some of the pieces that I've seen. I haven't worked too much with like long COVID or anything of that nature.
yeah. How do you feel like people can better support other people who are dealing with mental illness, PTSD, or
Mhm.
traumatic brain injuries in our community at large?
I think one awareness, two, not judging. Like we don't know what people are dealing with. We all have our internal shit that we
Yeah,
hold and it all impacts us on different days, different dates, differently. You can't force somebody to go to therapy, but just letting people know that there's people out there like professionals that you can, chat with and it doesn't have to be
yeah,
coerced. There's definitely people that kind of kind of want therapy but don't know what they want in terms of therapy or don't or know that they want to heal but aren't ready to heal. That's part of that therapist or counselor or psychotherapist really meeting that person where they're at and just
yeah.
saying, okay, I'll support you with this right now.
Okay. What do you feel are some things people can implement in their daily lives to improve their mental health and potentially prevent developing a disorder or
Mhm.
getting further into a disorder if they already maybe have something?
Yeah, I mean, self-care is talked about a lot in our culture, making sure we're doing small things for ourselves, aligning things to fit with our values, right? When we're often not functioning in our values, that's where we create a lot of stress in our lives. So noticing that awareness, right?
Yeah,
Is what I'm about to do going to move me towards or away from my values? It's a big question,
yeah,
right? Um,
okay,
finding avenues or releases for stress, gym, hobbies, gardening, walks, right? Chats with family if you're kind of more or not able to travel or going back to COVID, right? Like if you're
yeah,
if there are upticks in COVID and you still want to see family, having connection with other people is huge, right?
yeah,
Plants have been shown to help us regulate our nervous system, right? So there's a lot of plants in this office and I love it. Um, so there's many different things. Everyone's going to be a little different. For me, mine is time outside, time in nature, right? Scents, so like fresh
yeah,
rain, cut grass, stuff like that.
yeah. What's something that you would like to see change in the mental health field?
Hmm. I think on a larger level, I think most people in the mental health field would agree that most people are underpaid. So from a
Okay.
systemic level, right? Because I think that also influences how therapists show up, right? Whether people do certain jobs, even private practice versus like community mental health. It's like why
Yeah,
take a job where I can't support myself or my family, right?
yeah,
Um, so I think some of those are like bureaucratic, systemic pieces. Awareness is going to be huge, especially awareness around. And this is also linking what I just said. My other point too is like how does Medicaid reimburse, because that's a huge population, and Medicaid
yeah,
also sometimes has a very low reimbursement rate. and that gets into a political issue. I'm not getting into that, but um,
Yeah.
there are a lot of people that do need services that are at that level, and it seems like our society kind of pendulates in terms of mental health services are supported and then they're not, or it takes a huge incident to push us to find funds, and then a huge incident or lack of incident to move us back on the pendulum, right? And just the system we work in.
Yeah.
Otherwise, I think just the general awareness around like there are people out there that can chat, that a lot of what we talk about is confidential without there are very few parameters that we have to disclose information outside of confidentiality. So most of it's all protected.
Okay. What would you say to somebody who wants help with their mental health, but they see, the price of therapy is a huge obstacle and something that they can't overcome in their current lives? Maybe they're making minimum wage and
Mhm.
barely getting by as it is.
Um, that's a really good question. So I would look at what kind of health insurance do you have? Can you find a
Mhm.
therapist through there? If you're wanting to private pay, right? I would say looking at it as even using insurance too, but as an investment in yourself, right? Self growth. Um, Two, looking at your support network. Could they pay for things if that's something that you would want, right?
Yeah.
Um, there are also, and it's I don't know the names of a lot of the programs, but there are programs I know that in Denver, but I'm sure that there are other nonprofit programs throughout the country. I can't speak for other countries, but throughout the state that will also reimburse a therapist, like if you get into their program for therapy
Okay.
services. So it'd be essentially private pay, but the organization would pay. So doing some
Okay.
research and trying to find those, right, is crucial to access
Okay.
to care.
Awesome. Yeah. Thank you
Yeah,
for
and I
that.
think most therapists also have a few sliding scale spots. So it's kind of like, what can you pay? Right? Um, Sometimes they're
Okay.
full, sometimes they're not. If you can wait,
Yeah.
right? Those are things to ask
Yeah.
therapists.
Okay. Yeah. Great advice. Thank you.
Mhm.
What are some books or resources that you would recommend for people interested in mental health? I know you already mentioned the EDMR book by Paul Miller.
Yeah, yeah. So EMDR for schizophrenia by Paul Miller. Um, there's Dr. Shapiro's book on EMDR too. Trauma. And there's a lot of different trauma and recovery books from Bessel van der Kolk, How the Body Keeps the Score, to Peter Levine, Awakening the Tiger Within. Um, Judith Herman. It's a pretty dense book, but it's trauma and recovery. Uh, in terms of just general mental health books, I don't have a lot that I just have on hand, but I know that I've seen just from simple Google searches that you can put in, mental health for anxiety books or depression,
Yeah.
whatever it might be. Um, and a plethora of resources will show up. So I would definitely lean into
Okay.
Google.
Okay. Um, I saw that you are a reader, so do you have any books that you just recommend that aren't necessarily related to mental health that you just very much enjoy?
Yeah, um, not related to mental health. Um, Seven Habits of Highly Effective People by Stephen Covey. Um,
Okay.
I've really it can be a pretty harsh book, but I've really enjoyed David Goggins' material on Can't Hurt Me, his book. And then
Okay.
he has another book that just
Yeah.
came out. I can't remember the name of it. Also, Jocko Williams has some self discipline books that I've really kind of
Okay.
sat well with. Um,
Yeah.
Trying to think. Yeah, I just finished Paul Miller's book last week. So, and right now I'm reading. Polyvagal Exercises for Safety and Connection by Deb Donna. So that's one of those pieces that can be intertwined with EMDR to help regulate the nervous system, especially for people who have
Okay.
experienced trauma.
Awesome. Awesome. Thank you.
Yeah, of course.
Daniel, it's been amazing talking to you. Before we go, can you tell people how they can reach you if they want to work with you or if they want to find out more about the services you offer or and anything else that you'd like to share?
For sure. So, therapy is regulated by state lines in the US. So, if you're in Colorado, we can definitely do virtual or in person therapy. Outside of that, it could be coaching. Um, Give me a call, 720-295-6703. Website is www.revitalizementalhealth.com. You can submit a form on there. Otherwise, Instagram at revitalize_mental health.
Awesome.
Yeah.
Thank you so much. Daniel, it was great talking with you today.
Yeah, you too. You too. Thank you so much for allowing me some space to share my story and a little bit about what we do.
Thank you for listening to this episode of Thoughtfully Mindless. If you enjoyed the episode, if you share it, that always helps out a lot. And you can find me on social media, TikTok and Instagram at Thoughtfully Mindless, and Twitter or X at TM Convos. I'd love to hear what you think of the episode, so please feel free to reach out. Until next time.